Good patients, anxiety, panic attacks, and anxiety in the emergency room. What we gonna do? What we gonna do? Okay, so we gotta break this down. We gotta break down there's patients that have been diagnosed with anxiety already, and then there's patients that have never been officially diagnosed with anxiety and panic. All right, so those patients, fairly simple. If you've previously been diagnosed with anxiety, you are not presenting suicidal or homicidal, because those are some of the things we're going to want to make sure. You ain't trying to kill yourself, you ain't trying to kill nobody else. Okay,
911, what's your emergency?
because when you call your doctor, they just going to tell you to come to the ER anyway. What the ER going to do, child? What we going to do? Anxiety, you've previously been diagnosed. Maybe you've been one that has been on medication in the past. So you might have been on medication in the past. Maybe you tried to get off of the medication. That happens. Patients may feel good for a certain amount of time. Things in their life are a little bit more settled. So they do a trial of not being on medication. All right. Well, unfortunately, maybe it did not work and you need medication. It's okay. So those patients, when you go to the emergency room, it is okay to say, you know what, doctor, previously I was on this medication. You need to know the medication. You need to know the dose. You need to know how often you take it. Nothing worse than coming and you want to get a refill of a medication and you don't know nothing about the medication except the name. You need to know everything. Take a picture of the bottle. Always have it. That's not hard. You take pictures all the time, right? You take selfies, everything all the time. You know, take a picture of the medication so that way you know what it was that you were on. Okay? Even months later, it makes a difference because most emergency room physicians will not start you on one of those daily medications. However, most emergency room physicians may give you a refill of a medication, even if there was a time period where you were not on it recently. Here's why. We want to make sure people are stable. We want to make sure that you don't have a panic attack full blown. So if you come in and you need help and you're saying, you know what, I tried to get in to see my psychiatrist. I'm unable to do that. I'm trying to get a new psychiatrist. They don't have appointments for 1 to 2 months. And doctor, I was previously on this medication, even if it was a year ago. Here it is. Here's the name. Here's a dose. Here's how often I took it. Please, could you put me back on this medication because it has helped me control my anxiety before? Okay? That's how that works for patients who have established anxiety. Usually, not every doctor is different when it comes to those type of medications. However, when you can show some type of documentation, that's why I say a picture. A picture is always good off the bottle with your name. Your name. Okay, not your sister, not your mama, not your brother, not your child, not nobody else. It has to be your bottle. Or if you can come in with the pharmacy printout, maybe you go to CVS, Walgreens, Walmart, Publix, whatever, you're able to go to the pharmacy and say, pharmacist, please, can I get a printout of the medication that I was on a year ago? So that way, when I go to the emergency room, they can see, have documentation that I have previously been on this medication and it helped me. That's huge, okay? That's what you need to help the situation. All right, established. Now, those patients who have never officially been diagnosed with anxiety or panic, you come into the emergency department, unfortunately, you cannot present any of that. You've never been on anything, right? So that is a little bit more that ER doctor's discretion, okay? Usually, and actually let me break this down, let me back up. Anxiety, treatment. There's daily medication for anxiety, and then there's as needed medication for anxiety, okay? There are some patients who may only have a little bit of anxiety, maybe once every few weeks, maybe once a month. They're just unable to kind of control their emotions in certain situations, and it's rare. It's not like a several days a week thing. Those patients could benefit from medication that is more as needed. Okay, they don't necessarily at that time need a daily medication. They may just take a medication as needed, like Valium, like Xanax, like Ativan, like Klonopin. Okay, those are the as needed medications. Okay, benzodiazepines. I didn't even have to say that. Y'all know those medications. I didn't even have to say the group name. You done heard all the medications I just mentioned. All right. Then there's some patients that may need daily medication because they have the anxiety reactions so frequently. So almost every day they're going into an anxiety reaction, or they're having some difficulty controlling their emotions, or maybe every other day. It's just more common, so that they will benefit more from a daily medication to try to help control that. Okay, so those are the two types, groups, categories. The emergency room is really never going to initiate or start daily medication. We may refill it, as I mentioned before, okay, earlier in this video. Rewind or go back to the beginning, or wherever you're catching this at. I don't know, it could be a clip. Go to YouTube, go watch the beginning of that, and I'll talk about how that works. Now, as needed medications, that's where it gets a little tricky. We know that it can be very difficult to get in as a first-time patient with a psychiatrist. Very difficult, unfortunately. However, there are more resources available. There's telepsych. So there are companies that if you cannot get in with like a local or a psychiatrist in person, that you can do phone. You can do telehealth or telepsych. Okay? So sometimes that is a little bit more available. It may not be same day, but it may be same week. Okay? So we know that either way, it's difficult sometimes to get in with a new psychiatrist. Okay? That being said, those type medications, depending on the presentation, depending on making sure this person has no history of abusing these type of medication, that you weren't previously, unfortunately, on drugs or things like that, that you weren't previously abusing these medications. And sometimes we can see that. If we look it up, we can see, okay, this person got 60 of these pills last week. They got 30 of these pills 2 weeks ago. Well, that's not somebody we're going to give you anything. However, if we can see that what you're presenting is sincere, desperate, situational, you were trying, that helps in terms of giving a small quantity, a small amount of the medications like Xanax, Ativan, Klonopin, Valium. Okay? And actually, which of those medication will vary from doctor to doctor, hospital to hospital. Some have their protocols, they may not even do it, but it's becoming a little bit less stringent. And if you can get a doctor that, is understands in a sense what you're kind of going through, then they can give you, even if it's just 5 pills as needed, or maybe 10 pills as needed, that you can try to make a request for. And just don't be scared. Don't be scared. It's a no judgment zone. The more information you can give to help the emergency room physician understand your state of mind and why it is that way, and why you think this may help you, even if whether you have a support system, that's good. If you don't have a support system, that's good. But the more you can share about what's happening, the better the emergency room doctor is able to say, okay, you know what, I don't mind giving this patient 5 of Xanax, or I don't mind giving this patient 5 of Ativan. Okay, so it does vary, but again, it helps what you can share, what's going on in your life, what's different, why it may benefit you. I've never been on this medication before, doctor, but I think I need to try it and see if it will kind of help me, get through. I have an appointment scheduled for 2 weeks. All those things help build a story that can help a doctor give you, even if it's just a few. Ask for it, because they may not offer it. Ask for it, because they may not offer it. All right, and that way you can have something as a bridge until you can get your telepsych appointment, or the appointment that you are going to schedule, because you're going to need follow-up to have a continuity of care with the psychiatrist. Okay, so that's what I wanted to say in terms of those 2 different types of groups and how the emergency room manages them and what you can expect when you come in with anxiety or panic.
911, what's your emergency?